Hi, how are you?
Good. How are you?
Good, thank you. Thanks so much for having me today.
Oh, it is a pleasure. We are very happy to have you here.
Oh, thank you.
Good afternoon. Thank you very much, everybody, for joining us in this powerful educational lunch and learn, which is brought to you by Family Partners of Morris and Sussex counties. Right here, this is your host, Patricia Houston, and today, King Mayer from the Brain Injury Alliance of New Jersey is collaborating with us to discuss brain injury and also substance use. Therefore, without further ado, I just want to give a big welcome to King Mayer.
Awesome. Thank you so much, Patricia. I really appreciate you having me today. And I'm looking forward to discussing this topic more. Like you had said, I am a community outreach specialist at the Brain Injury Alliance of New Jersey. So just some brief information about the Alliance for everyone who's attending today is it's a statewide nonprofit focused on preventing brain injuries and also helping those who have had brain injuries. So we provide direct services, support services like our care management program, but then we also come out and do education like this. So let me just pull up my screen. And can everyone see my screen?
Yes.
Okay, wonderful. Um, so like I had said, just brief intro, Brain Injury Alliance, statewide nonprofit focused on brain injury. So today, along those lines, we'll be discussing substance use and brain injury, the really complex relationship between the two and how they might affect one another. So first we'll discuss how to define brain injury. What is a brain injury? So there's two different types of brain injury. They're categorized as acquired brain injury and traumatic brain injury. So an acquired brain injury is more an external or an internal event to the brain that occurred after birth. So this can be something like stroke, aneurysm, seizure, and a near drowning experience. Anything that results in a lack of oxygen to the brain causes an acquired brain injury. So along the lines of substance use, a overdose would be an acquired brain injury due to that lack of oxygen to the brain. There's also traumatic brain injury. So this is an external force to the brain, what we might think of when we think of concussion. It can be any sort of blunt trauma. It can even be something like whiplash, that acceleration, deceleration force. We see this kind of brain injury often in military personnel due to blast injuries. So the brain is a very complex organ. It truly does control everything we do, from walking to making our coffee in the morning, breathing, sleeping. It is in control of our mood, our language, our memory. So if we sustain a brain injury, some or all of our functions can be affected. So depending on the part of the brain that's injured, it might result in different symptoms. So for example, the frontal lobe, which is the most commonly injured part of the brain, is in control of judgment, behavior initiation, planning, organization, attention. So these things might be affected. So the brain is attached to the brainstem, but otherwise it's floating in a fluid called the cerebrospinal fluid. So within that floating in that fluid, it's protected by the skull. So this is a view of the skull from above, if you were looking down at someone's head. So as you can see, the skull has these bony ridges. So when we hit our heads, then those bony ridges can injure that brain since the brain is so fragile. So due to the bony ridges, the frontal and temporal lobes are at most risk of injury. That's the blue one and the red one in the picture. So these can affect judgment, behavior control, emotion regulation, motivation. So this has really significant implications when it comes to substance use. So brain injury is a major health and safety issue that's unfortunately little recognized. So the CDC has deemed brain injury a silent epidemic. The problem is really large, really widespread, and awareness is not where we would like it to be. So most people or many people might not know exactly what a brain injury is, what's encompassed under a brain injury, like stroke, seizure, overdoses, drownings. So CDC also estimates that 1.5 million people sustain a brain injury each year. And like the slide says, an estimated 5.3 million Americans live with a disability as a result of a traumatic brain injury. So we always like to say no one is immune from a brain injury, right? So just in the same way that no one is immune from, say, breaking their arm. But it's also called a silent epidemic because unlike a broken arm, you might not be able to see it with your eyes, right? So you can be standing next to someone in the supermarket who has a brain injury, and you might not even realize it because it's internal, right? You can't see it. So brain injuries are categorized as mild, moderate, or severe, depending on the neurological injury at the time, as well as the period of time the individual had lost consciousness for. So this is kind of a loose model. Some people are moving away from this model, being that there's so many intricacies with brain injury. It might be, in between mild and moderate or moderate and severe. It's just a very complex injury and sometimes hard to categorize like this. But a mild brain injury is the most common type of brain injury. So many people with this type do not seek medical care or go to the hospital. So we think it's vastly underreported. A concussion is considered a mild brain injury. So they're basically interchangeable. The terms mild brain injury and concussion mean the same thing. So an individual can potentially fully recover from a mild brain injury. But a complicating factor is that symptoms might not appear right away. They might appear later on. Someone might feel fine after the incident, and then down the line, say 2 or 3 days down the line, they start to feel strangely and symptoms start to present. Generally, symptoms of mild brain injury improve over 1 to 3 months, but repeated concussions do compound the symptoms. So they have a cumulative effect. Each concussion you get gets worse and worse, basically. And then there's also second impact syndrome, which a lot of people speak about now, especially in relation to sports, where if you get a second brain injury when you're still recovering from the first one, it can have really serious effects. There's also post-concussive syndrome, which you might have heard about as well, which are when symptoms are really long-term. So we can compare it to long COVID, how some people experience long COVID, where the symptoms just aren't going away for months and months. Some people have this effect with concussions too, where they might have many months of symptoms. They're just not going away. Something important to note about mild brain injury is that most people do not lose consciousness. They might lose consciousness up to 30 minutes, but most do not. And a mild brain injury does not appear on any sort of imaging scan, like MRI, CAT scan. It won't appear on any of those. So it is a little bit more difficult to diagnose, and diagnosis is just based on whether there was an event that caused the injury and then what the symptoms are. So an individual who sustains a moderate brain injury may experience contusions or bleeding on the brain, be unconscious for up to 24 hours, or have signs of brain trauma. So these can have really significant impacts, serious symptoms, and these injuries can often be seen on a CAT scan or MRI. And severe brain injury, those with a severe brain injury may be unconscious for more than 24 hours. They may show signs of injury on MRIs, CAT scans, other neuroimaging tests. And they also may experience post-traumatic confusion or amnesia. So they might not remember the incident at all, which makes it more difficult to diagnose as well. Or they might not remember anything past the incident, or might not remember anything before the incident. So they might have these serious memory impairments. So since the brain is the control center of everything we do, a brain injury can impact us basically in any way. It can affect our physical functioning, cognitive functioning, or even emotional and behavioral functioning. So here's a brief clip from the movie The Lookout. And just let me know with a thumbs up if you can hear the video once I start.
I wake up.
Can you hear it?
Turn off the alarm. I look outside so that I know what to wear. I take a shower with soap. And then I shave. Sometimes I cry for no reason. But I'm getting a handle on it. I wake up. I get dressed. I take my meds. When Lewis is gone, I make the coffee, which can be tricky. I eat breakfast, but I don't read the paper. It confuses me, which makes me mad. I wake up. I put on my coat and go to class. I wake up.
10 more seconds. We're just doing one day, okay? No big deal. And time. It's okay, Chief. It's not a test.
So what are some challenges that the character faced in this clip? Did anyone notice any issues he was having? And if you wanted to put something in the chat too, feel free to do that as well. Absolutely. He was struggling trying to recall what he did that morning to put his day in order. Yep, keeping things in order. Definitely sequencing. So one of the symptoms of brain injury that we often see in survivors is sequencing issues. And thanks for your comment, Lindsay. I'm glad that you're here. All right, so some other things that he did in the clip. Oh, someone else. Yep, coping with changes in schedule. Yeah, so sometimes routine can be really helpful in doing the same thing every day. But then if there's a change in schedule, it can cause a lot of issues. So it seems like also he might have some comprehension issues. He says reading the newspaper is very confusing. It makes him mad. Mood changes. So he said he cries easily. He gets angry randomly. And also following instructions. So even something like making coffee, he has a lot of difficulty remembering to grind up the beans. Something that seems so simple to us, like making coffee, becomes really difficult for someone with a brain injury because you have to remember all the steps to put the coffee pot underneath, to grind the beans, to put the beans in, to put the filter in, to put it in, know how to start it. It's all of these steps that we don't even think about. So those are just some ways that it can impact someone's life. So I won't go through all of these because it's a really long list, but it may cause some physical changes like fatigue, loss of smell and taste, hearing problems, motor control, slurred speech. We see communication difficulties a lot in people with brain injury. May cause headaches. And also cognitive changes. So any communication issue, like I said, memory loss, impaired reasoning, controlling impulses, being able to complete tasks, organizing or planning, focusing, attention span, anything along those lines. It's really any cognitive function that it can affect. And also emotional and behavioral changes. So someone might report anxiety, depression, angering very easily, being more aggressive than before, maybe irritable. But also another thing is change personality. So we hear from a lot of survivors that after their brain injury, their friends and family were telling them that they seemed completely different people, like they were different people because they had a complete change in personality. So these changes have a significant impact on many elements of a person's life, including a person's relationships, their job. So it's been shown that 55% of people are not employed after a moderate to severe injury. This can affect their finances. They might have a lot of medical bills. If they don't have an income, then they might experience financial struggles. Might affect their ability to live independently if they need to rely on someone else for basic tasks like hygiene and cooking. They might not be able to participate in recreational activities they love to do before, like their hobbies. And they also might have issues with transportation. So if they can't drive, which many brain injury survivors with moderate severe brain injury can't drive. And taking public transit can be really complicated, right? It can take a lot of steps trying to figure out the schedule, getting there on time, especially if there's a lot of moving parts. So every individual is different prior to an injury, and every brain injury is different. So being that we're all different individual people, we all would cope with that differently and have different symptoms. So next we'll talk a little bit about substance use and brain injury, and the connection between the two. So Dr. Corrigan is the director of the Ohio Valley Center for Brain Injury Prevention and Rehabilitation. So he's contributed a lot to the field of brain injury, and this is a quote from him. He says, "Substance abuse is a risk factor for having a traumatic brain injury, and traumatic brain injury is a risk factor for developing a substance use problem." So it's kind of a bi-directional relationship there. So this is just a brief clip that highlights the relationship between substance use and brain injury.
At the JFK Johnson Rehabilitation Institute, inside the brain trauma unit, 24-year-old college student Joe Hartman stopped to encourage a patient.
And I'm gonna pray for you every day.
I didn't even recognize him.
It's one of those great surprises.
I'm having goosebumps.
This isn't what Hartman looked like when staff here first met him. As a patient here in December of 2016, suffering from a brain injury.
He comes in, he's wheelchair bound, can't really do a thing for himself, can't feed himself, can't see, can barely speak, unable to swallow.
Heroin, cocaine, acid, meth, anything you can, if you can name a drug, I did it.
Hartman says he started taking hard drugs when he was 14 years old. In and out of rehabs, his drug of choice was heroin. About 2.5 years ago, he overdosed on cocaine that he believed may have been laced with fentanyl, and he thinks that's why he fell into a coma.
I was bleeding from my nose and my mouth, and I wasn't breathing, my heart wasn't beating.
Dr. Brian Greenwald says that's when Hartman's brain likely suffered the trauma. Greenwald says he's seeing an increase of patients who survive an opioid overdose but suffer brain trauma because of a lack of oxygen to the brain during that overdose. Even a few minutes can cause a serious brain injury.
An area of the brain called the hippocampus is an area of the brain that sits in the deep part of our temporal lobes, sort of the temporal lobes here around our ear. That area of the brain is uniquely sensitive just by a short period of low oxygen in the brain, and so commonly causes these type of memory issues. In his case, also the area in the back of the brain, the occipital lobe, was affected also, and that's why Josephus has some of the visual troubles that he has.
Hartman spent about a month at a hospital in Florida after his overdose before it was recommended he be transferred to see a brain trauma specialist to get the appropriate evaluation and treatment. But Greenwald is worried there are many survivors of opioid overdoses who don't realize they also suffered brain injuries.
Maybe people are blowing it off saying, oh, it's just related to the fact that they've been a long-term drug user, and not appreciating the fact that it was really due to lack of oxygen to their brain.
Maybe they go back to work and they're not able to focus on their jobs or focus on school. That's usually related to the injury that brain sustained because of the drug overdose.
According to the Brain Injury Association of America, those with a prior history of substance misuse before their brain injury are 10 times more likely to resume past behavior. So the organization is stressing the importance of treating both brain injury and addiction together.
I'm honestly not so sure how much the medical community is even recognizing this as a potential risk.
Hartman is one of the lucky ones.
I couldn't have done it without all your guys' help.
Greenwald says many opioid overdose survivors may be suffering in silence and recommends anyone with symptoms like memory loss, loss of full motor skills, and similar symptoms get an evaluation from a brain injury specialist. In Edison, Leah Mishkin, NJTV News.
So that just kind of showed some of the relationships between the two and how a substance overdose can cause brain injury. So it increases risk, but also inhibits recovery. and we'll talk a little bit more about that. We'll begin by looking at the risk. So a lot of research has been done specifically regarding alcohol, but some of the research also pertains to substance use disorder in general. So these statistics are regarding alcohol specifically, but it's still great information, I think. So those who consume alcohol have a 4 times higher risk of sustaining a TBI. It was also found that 30 to 50% of people who sustained a traumatic brain injury were intoxicated at the time that they were injured. And then 54% of those with a traumatic brain injury were under the influence when they sustained a second traumatic brain injury. So we do see this very strong link. So substance use increases risk of brain injury. This is due to multiple reasons. So substance use can lead to overdoses, which, like we spoke about, can cause lack of oxygen to the brain. It may lead to interpersonal violence, which can lead to a traumatic brain injury. Same with motor vehicle crashes if someone is driving under the influence. It can lead to falls or injuries, leading to brain injury, and also non-fatal self-harm. So brain injury also increases the risk for substance use. So we, again, have this bidirectional relationship. So statistics show that 10 to 20% of those with a brain injury, or 10 to 30% of those with a brain injury, develop a substance use disorder after sustaining the injury. This is much higher than the general population. Many people stop using substances for a short time after sustaining a brain injury. Maybe the substance isn't accessible due to their treatment. Maybe they're in the hospital. Their support system might be more present, so they might not have the opportunity to use drugs as much. But those with a prior history of substance misuse before their brain injury are then 10 times more likely to resume past substance use after the brain injury. And also 50% of those with substance use disorder have sustained a brain injury. So this is really significant as well. So there's a few possible reasons why this might be. So as we've noted, brain injuries can cause significant changes to a person's life. They might turn to substances as a way to cope with these changes, as a coping mechanism. Those with a brain injury may also have easy access to prescription medications, maybe if they're prescribed pain medication. Also, they may be socially isolated or have excess free time. So if they're unable to work, if they can't participate in recreational activities, they may have all this free time and then turn to substances to fill this void. And also those with a brain injury may experience inadvertent enabling by well-meaning friends and family. So they may feel sad or guilty about what a person went through, so they may inadvertently enable them. But also substance use inhibits recovery from brain injury. So individuals have a lower tolerance to substances after a brain injury. So if someone would be able to drink, say, 3 beers before a brain injury, they might only be able to handle like half a beer after the brain injury and feel extremely inebriated after just 1 beer because of the effect that alcohol has after a brain injury. And any substance really has after a brain injury, including drugs. Substance may cause new damage to the brain, may compound the effects of the brain injury. It may cause seizures even. So a symptom of brain injury is seizures, but also substances can cause seizures. So this risk is doubled. And then they might also sustain another traumatic brain injury for the reasons that we had stated before, like they might be driving under the influence of substances, they might be getting into conflicts, or their judgment might just be off due to the symptoms of the brain injury. And substances may also interfere with the brain's ability to create new connections between cells that were damaged due to injury. So studies have found that the brain is trying to heal after the injury by creating these new connections. But when someone uses substances, that really gets in the way of these new connections forming. So it is suggested that people don't even drink at all after brain injury. So doctors will ask those who have had a brain injury not to drink at all, not to use any recreational drugs due to the effect that they can have. But also brain injury inhibits recovery from substance use. So brain injury might make it more difficult to recognize when a substance has become addictive, or has started to have negative effects on someone's life. It makes it difficult to understand the negative impact that substances might have on the body, especially the long-term impact. And it may make it difficult for people to have the confidence to admit to others that they have this issue and then to seek help. So while this is difficult for anyone misusing substances, someone with a brain injury may already be experiencing social isolation, or relying on others for a myriad of things. So this may cause feelings of shame, which can compound this unwillingness to seek help due to this shame. So what can we do with all of this information? So if you don't work directly with individuals who struggle with substance use or have a brain injury, you can still raise awareness of this issue, right? Passing this information along to friends or family members who either know someone with a brain injury, or know someone who is experiencing difficulties with substance use. And adolescents especially can benefit greatly from this information. So the CDC does indicate that in 2019, 15% of all high school students received at least one concussion, which is a mild traumatic brain injury, and 15 high school students have used illicit or injection drugs, and 14 have used opioids. So we're seeing very high rates of brain injury in high schoolers, but also very high rates of substance use. So these two factors combined are really a cause for concern. So if you do work with those who are at risk of substance use, acknowledging that the impact that the brain injury might have on the individual is important. So individuals with brain injury are often on medications to treat their injury. So being aware of how these medications might be impacting them, how the medications would interact with any psychotropic medications, being aware that they're receiving various types of treatment at the same time and how these might interact. Also recognizing that they might not intentionally be non-compliant with treatment. They might have difficulty understanding the treatment, remembering what to do, seeking treatment in the first place. They may require direct feedback, or might require sessions to be tailored to the individual. And then also it's important to be aware that they may have trouble building support networks, or that there may be a lot of nuance or complexity to their support networks due to a brain injury. So many people have a loss of support network after brain injury, unfortunately. So, if their personality changes, if they're having mood difficulties, if they're irritable, getting angry easily, their support network may step away. They might not be there for that person in the same way as they were. So this can complicate it as well. So it's also important to work to minimize distractions such as noises, interruptions, bright lights can make it really difficult for a client to focus. When you're working directly with a client, you can break tasks down into smaller pieces that are easier to manage. So it is really helpful to write out what they need to do so that they can process it on their own. They can go back and read it again if they forget what it might be, and that way they can have a reminder. Also, if there's an appropriate time to do so, you might consider pointing out the possible consequences of any decisions that they may be making, such as with substance use. Individuals with brain injuries might not be able to grasp or comprehend the effects, the long-term effects of their decisions due to their injury. So gently bringing this to their attention may be helpful. And then also confirming that they understand you. And this is for anyone with a brain injury, just confirming that they understood what you said, and that if they need a written reminder or need you to write it down, that you're able to do so. They might even ask you the same question over and over. They might ask you the same question 3 times due to memory difficulties. So in this case, it also would be helpful to write something down or set a reminder. And there's also specialists out there who may be able to assist with the brain injury aspect. So neuropsychologists have expertise in assessing the relationship between the brain, behavior, and cognition. They can identify how problems with attention, working memory, and other cognitive skills may possibly interfere, and also teach the student strategies to compensate for these symptoms they may be experiencing. And also a neuropsychiatrist can prescribe medications for managing behavioral issues, accompanying neurological illness or brain injury, And they can also provide medication treatment. So whereas the neuropsychologist generally will not prescribe medication, a neuropsychiatrist can. So they can give medication specific to substance use withdrawal or maintenance of sobriety or to recovery from brain injury. So further research is needed on how marijuana affects those with brain injury. There has not been any significant research on this intersection, on specifically how marijuana affects those who may be experiencing a brain injury. And the current suggestion is that it likely has more negative effects than positive, but there does have to be more research done on this. And it's also important to increase awareness and training opportunities for professionals working with those struggling with substance abuse issues so that they may be aware that a brain injury may be complicating the symptoms or making it difficult to recover. And then we always work to increase prevention and education for students also who are beginning to experience with substances and are potentially sustaining injuries through sports or other means. So these are some resources. The CDC has some great resources about both brain injury and substance use. The SAMHSA, the Substance Abuse and Mental Health Services Administration, has a lot of great resources, as well as the National Institute on Alcohol Abuse and Alcoholism. Brainline has a lot of great information on both topics as well. Brain Injury Association of America, as well as the Model Systems Knowledge Translation Center. So Model Systems is something we refer to a lot in our work. They're quite possibly the largest store of traumatic brain injury and brain injury research and information out there. So they have awesome educational guides, resource guides, like pamphlets, handouts. They have a lot of great stuff. So like I had said before, I went over this briefly, but the Brain Injury Alliance of New Jersey does have direct services, education, prevention, and advocacy. So we have a this is all free, all of our services are free. We have case management for children and adults. We have a helpline for those with brain injury if there's any questions about anything related. We have support groups all over the state, in person and virtually. We have a week-long camp every year for adults with brain injury, and that's down in South Jersey. And then we also like to give the TBI Fund a shout out. So the New Jersey Department of Human Services, Division of Disability Services, coordinates this funding source. It's a payer of last resort for people with brain injury. So this fund purchases supports and services to foster independence and maximize quality of life when insurance, personal resources, and public programs are unavailable to meet an individual's needs. So there's 3 qualifying criteria, and that's that recipients must provide medical documentation of traumatic brain injury, have liquid assets of less than $100,000, and be a resident of New Jersey for at least 90 consecutive days. We also have webinars. We have those once a month. The next one coming up is TBI in the media. We also have suicide and TBI coming up, and one about the Traumatic Brain Injury Fund. We also have workshops on many different topics, one of which you're seeing right now. So we have a variety of topics along those lines too. I think we're up to probably close to 30 topics. And we have regional trainings every year, annual professional seminar, and then Family Fest, which is a day for families impacted by brain injury every spring. And this spring we're having that at Turtleback Zoo and also at Woodford Cedar Run Wildlife Refuge. We have the UDOT Brains Champion Schools program. This is a high school program where schools receive a group of students from a school receives $1,000 stipend to create a transportation safety campaign. And they compete against each other to win $10,000. And they have this big showcase at the end where they show off their projects, what they made. And it's a lot of fun. It's a great program. We also have Jersey Drive's webpage, which is all about driving safety, and a legislative network where we do legislative advocacy. So this is some of our information. We have our Facebook, Twitter, YouTube, Instagram, our website. And this is my information. I can put that in the chat as well if anyone would like to access that through the chat. We do have a feedback survey. If anyone wouldn't mind filling that out. I think it's 2 questions or 3 questions. It's really quick. And yeah, our website's on there. my name. So I know I'm a little bit early. I'm a few minutes early, but if anyone has any questions, I would love to take any questions.
Kim, I just want to thank you again for doing this presentation for us and for our community, as well as to the Brain Injury Alliance of New Jersey for having this type of presentation available. So thank you very much. With that, we are going to move to our Q&A session. That part is not recorded. Thank you very much.
Thank you.